Hi everyone, today we're going to be talking about the association between insufficient sleep and mental health in the Asian American subgroups using the National Health Interview Survey from 2006 to 2018. Over 1/3 of Americans experience insufficient sleep. Not getting enough sleep can increase the risk for mental health disorders, increasing levels of anxiety and distress. Specifically, Asian Americans are 3 times less likely to seek mental health services than other Americans, even though Asian Americans have high rates of suicide. There has been much research tying mental health and sleep together. However, research on sleep patterns and mental health in the Asian American community is severely lacking.
While the association between sleep and mental health are studied before, there was no specific focus on the disaggregated Asian American subgroups, despite the heterogeneity of this group. So we asked this question, what is the association between insufficient sleep and psychological distress in the disaggregated Asian American subgroups from 2006 to 2018? We first did our descriptive analysis looking at the psychological distress and insufficient sleep. We found that the prevalence of psychological distress is about 4% of in our population of interest, with 3.47% in non-Hispanic white and the lowest being in Asian Indian, which is 1.18%. Insufficient sleep has the prevalence of 33%, with the highest being in Filipinos, which is 38.4%. And the lowest being in Asian Indians, which is 24.5%. And then we did multivariate logistic regression to look at the association between insufficient sleep and severe psychological distress. And we found out the overall odds ratio is about 2.35, and in non-Hispanic is 2.35, and the odds ratio for all Asian subgroups are different, as you can see here. And then we conclude that insufficient sleep is associated with severe psychological distress, but to a different extent in different Asian subgroups.
We hope that in the next project on this topic, we will further disaggregate the Asian American subgroups, as we were not able to do so in the study due to a small sample size. As well as to further analyze these results, we believe that understanding the genetic influences on sleep patterns and psychological distress will be vital amongst the disaggregated groups, as well as how substance abuse and addiction can influence inadequate sleep and mental health amongst those disaggregated. Thank you so much for taking the time to listen.